Oh, they got me getting up on this chair now. Ugh. Bridget, you're a 55-year-old male, but it sure feels like you're 100. My right leg's been hurting for the past 2 months. This week it hurts so bad. I got pins and needles all the way down to my toes. My back's been hurting too. It's getting worse and worse. I really hope that this physician assistant can help me.
Alright, come in, wash my hands. How's it going today, Bridget? My name's Zach. I'm the PA student. I'm going to be taking care of you today. I'm going to be doing your physical exam. We're going to start out with your vital signs, starting with your pulse here.
When Zach walks into the room, he's examining the patient, doing a general survey, looking for apparent state of health, signs of distress, facial expression, posture, gait, and motor activity. When he's taking the heart rate, it's important that he uses a radial pulse. He's noting rate, rhythm, amplitude, and the contour of the pulse, counting for 30 seconds if the rate is regular and the rhythm is regular, and if they're irregular, he'll count for 60 seconds.
Good. All right, Bridget, we're going to move on to your blood pressure now.
When taking the blood pressure, it's important to make sure that the cuff is of the right size. If the cuff is too small, the blood pressure can read high, and if it's too large, it'll read low. Blood pressure can be elevated in situations where a patient is in pain, is a smoker, or is in a state of stress. It's important to allow the patient to sit back and relax before taking blood pressure for at least 5 minutes without eating, smoking, drinking, or talking. When Zach is taking her blood pressure, he's going to hold her arm at heart level. He's going to palpate for the brachial artery before and listen with the bell of the stethoscope. Using the diaphragm of the stethoscope can also lead to an improper reading. He's listening to hear the corticoff sounds. The first 2 sounds he hears are systolic pressure, and the last 2 are the diastolic pressure.
All right, 120/76, Bridget, good blood pressure.
This would also be done on the opposite arm.
All right, we'll there for me.
Also throughout the exam, Zach's going to be looking for the respiratory rate of the patient. He's observing rate, rhythm, depth, and effort of breathing, and try to count the number of respirations that the patient has in 60 seconds.
All right, 120/76 as well on that arm, Bridge. Good blood pressure. All right, Bridget, give me a few seconds while I jot down the vitals that we just took.
Before Zach came in the room, the medical assistant took the patient's height and weight. The height was 5 foot 8 inches, and the weight was 190 pounds, giving the BMI of 29. The MA also took the pulse ox using a pulse oximeter. It was 98% on room air, and temperature using tympanic thermometer, which was right after 2 seconds, to 99.1 degrees Fahrenheit.
All right, Bridget, we're going to move on to inspecting your skin, your heart, and your lungs. So if it doesn't put you in too much pain, are you able to stand up for me?
Yeah.
Here, I'll help you up off the table. All right, awesome. And kind of put your arms out to your up like this. I'm just going to be inspecting your back.
Zach's inspecting for color, pigmentation, moisture, textures, and any rashes or lesions present on the skin. A pearl with the skin exam is to look for rashes that are over a single dermatome, which is suggestive of herpes zoster. Also to look for any other cause of the patient's pain. A pitfall here will be not having the patient disrobed or exposed properly. We're just wearing pants for privacy reasons. Next, we're going to move on to the lung exam.
All right, Bridget, I'm going to listen to your lungs now. Can you put your arms up on your shoulders like this, kind of like a G? Awesome.
Do you want this thing down? Or you both?
What's that?
Do you want this thing down?
You can leave it like that. I have a good space to work back here. All right, when you feel the stethoscope on your back, can you take a big deep breath in for me?
Zach's inspecting and auscultating posteriorly right now with the patient's arms crossed in front. Another position named for this position is the genie position. Having the patient take a few deep breaths in and out as he inspects and auscultates. He's looking for impaired respiratory movement, rate, rhythm, effort of breathing. He's going to be listening to the apices and 7 areas posteriorly and comparing side to side in a ladder formation. A pearl here is to make sure that the patient's mouth is open and the stethoscope is directly on the skin.
Look that way and breathe every time I feel my stethoscope.
He's now performing the exam anteriorly, again in a ladder formation covering 6 areas, comparing side to side. And lastly, he's going to check laterally.
Almost done. All right, everything sounds good. All right, Bridget, I'm gonna listen to your heart now. Just relax for me. Nice, easy breaths.
In the heart exam, we are auscultating in multiple locations. We're going to be listening in the right second intercostal space for the aortic valve, the left second intercostal space for the pulmonic, left third intercostal for Erb's point, the left fourth for tricuspid valve, left fifth intercostal space, and listening at the apex. A pearl here is to listen for 2 to 3 seconds in each spot, listening for S1 and S2 sounds, and also listening for any abnormalities using both the diaphragm and the bell. A pitfall here is applying too much pressure when using the bell, which makes it act like the diaphragm and giving you an inaccurate reading and inaccurate auscultation.
Okay, Bridget, my nurse informed me that you were wearing some athletic undergarments that would make this assessment a little bit easier. At this time, would you mind taking off your gown so that we get a better full body assessment? Mm-hmm. Okay, awesome. So if you could do that now. Yeah, and then I'm gonna have you stand up for me, please. Just right here, and I'm just gonna take a look at your gait right now. If you wouldn't mind just taking a few steps out towards me. Turn around, a few steps back.
Now Zach's inspecting the spine for posture and spine deformities. When viewing from behind, he's identifying the spinous processes, paravertebral muscles, the iliac crest, and the PSIS. From the side and behind, he's identifying the spine's curvature. A pearl here is to make sure that the spine is exposed from the SI joints to the base of the skull. A patient with lumbar spinal stenosis may have posture that is flexed forward to reduce their symptoms.
Okay, Bridget, I'm also going to examine your spine. I'm just going to walk my fingers down the back of your spine. Let me know if you feel anything.
Zach's examining with palpation for tenderness, crepitus, warmth, and edema.
Okay, you just want to have can you lay down on the bed for me, please? Or the table?
He's now examining with palpation the hip, the knee, and the foot and the ankle.
Okay. Would you mind rolling towards me, please? Want to roll on the left side? Okay, and then kind of bring your knee up to your chest here. Kind of flex it up.
Now Zach's palpating the sciatic nerve. With the patient's hip flexed and lying on the opposite side, he is looking for tenderness and checking for pain and radiation into the buttocks, perineum, and the legs. He's also looking for tenderness in the ischiogluteal bursa, which may mimic sciatica. He's palpating for step-offs of the vertebrae, which suggests a spondylolisthesis, and for herniated discs, which are most common in L5-S1 or L4-L5. A patient may exhibit tenderness on the spinous processes, intervertebral joints, sacrosciatic notch, and the sciatic nerve.
Okay, Bridget, I'm just going to test your range of motion now by asking you to do a few movements for me. Are you okay with that? Mm-hmm. All right, awesome. So first we're going to start with a little forward flexion. So can you bend down and touch your toes? Awesome, stand back up. Any way you can lean back. Perfect. All right, can you kind of put your hands on your shoulders like a genie? All right, can you turn to your right for me? Turn back to the middle. Turn to your left. And back to the middle. All right, can you kind of put your hands out to your side? Okay, can you take your right hand, touch your right knee, a little bending, back up, and take your left arm down your left knee, and back up. Perfect. Okay, Bridget, we're gonna test some hip movements now. So would you mind, with your right leg up, kind of kick it out forward? Awesome, and back to the center line, and backwards. Perfect, can you take it out to your side like this? Perfect, and then can you cross it over your other side? Awesome, now we're gonna do the same thing, but with your left leg now. So kick it out in front, take it back. Okay, you can stabilize yourself if you want. Kick it out to your left side there. Come back to midline and cross it over. Perfect, can you have a seat on the table for me? Okay, now we're just gonna do a little internal external rotation for your hip now. So kind of can you bring your right foot out to my hand here? Perfect. And can you cross it over midline here? Perfect. We're gonna do the same thing over here. Bring your left leg out to my left hand and cross it over in your midline here. Perfect. Okay, Bridget, now we're gonna do a little knee flexion extension, and we're gonna do a little flexion extension with your ankles as well. So could you just kick your right leg out straight for me? Okay, and then bring it back towards your body. Perfect. Can we do the same thing on the other leg? Bring it out and kick it back in. Now with your feet, can you bring them up towards your knees and down towards the floor? Perfect. And then can you point them in towards each other and away from each other? Awesome. Okay, Bridget, we're going to do some of the same types of movements, but now we're going to do them against resistance. Okay? So we're going to start down at your feet and work our way up. Okay, so first I want you to take your right foot here, kind of flex it a little bit, and push out against my hand. Can you do that? Okay, push in. Good. Okay, now we're going to do a little plantar flexion, or dorsiflexion, I guess. So point up towards your knee, and push down like you're pressing on a gas pedal. Good. Do the same thing on the other side. Okay, can you press out for me? Press in. Bring your toes up to your knees, and press down like a gas pedal. Good. We're going to test your knee now. Okay, so can you bring your knee up? Push against my hand here. Perfect, keep it there. Now I want you to bring it back in towards your body. Good. Other leg. Can you kick it out for me? Keep it there. Now bring it back in towards your body. Good. Okay, Bridget, we're now going to test your hip range of motion now against resistance. So first things first, I'm going to take your right thigh here, and I want you to push up against my hand if you can. Perfect. Same thing, push up. Awesome. All right, now we're going to test some adduction. So we'll start with abduction. So, let's see. All right, so I want you to push out against my hands here. Good. And kind of squeeze in. Perfect. Okay, and we're going to do a little internal and external rotation with your hips. So what I want you to do, okay, is I'm at my hand here. I want you to kick your foot out towards me. Perfect. Same thing, I want you to bring your foot away from me now. Good. Okay. So same concept, I'm going to have my hand here, push against, and push in. Perfect. Say that for me. All right, now we're going to do a little hip extension. So we did the flexion before, now we're going to kick our leg back for me. So I want you to take your right leg, and I want you to kick backwards if you can. I'm going to do the same thing with the right leg. Kick back. Awesome. Okay, Bridget, and the last resisted exercise we're going to do is going to test your back here. So first things first, I want you to cross your arms across your chest. Okay, and I kind of want you to bend forward against my resistance here. Okay, back up, and lean back for me. Okay, perfect. Now I want you to turn this shoulder towards me. Okay, and don't let me push you back. Perfect. Other way. Resist it. Don't let me push you back. Perfect. Now I'm going to stand behind you. We're going to do a little bending. Okay. So I want you to take this arm down to your knee and push against my hand. Good. And the same thing on the other side. Left hand towards your left knee. Perfect. Good. Okay, Bridget, I'm going to perform a few special tests on you now. Okay.
Zach's going to begin with the straight leg raise, testing for lumbosacral radiculopathy. A positive test here would be pain radiating into the leg. Dorsiflexion of the foot may further increase leg pain and indicate sciatica. Tightness or discomfort in the buttock or hamstring are not positive tests here, as some patients have tightness in these areas. Next, Zach is going to do the Faber test. This is testing for arthritis and sacroiliitis. A positive sign here would be pain in the hip or sacroiliac joint when he presses on the flexed knee and opposite anterior iliac crest.
Okay, Bridget, we're now going to move on to the neurologic part of your physical exam. Okay, so what I want you to do is I want you to hold out your hand, close your eyes, okay? This is sharp, this is dull, okay? So I'm going to move to different parts of your lower body here, and I want you to tell me if this is sharp or if it's dull. Tell me what you feel.
Zach's performing a sensory exam here. All tests should be done comparing one side of the body to the other and comparing distal to proximal areas. Before each test, show the patient what you plan to do and explain how you want them to respond. For our patient, we will concentrate on his lower extremities, since that's where the complaint is. This exam is important to rule out a neurologic cause of the patient's back pain.
Okay, Bridget, we're not going to do the same exact exam we did for this, but we're going to do a little light touch sensation, examining your sensation down in your lower body. Okay, so you're going to feel this. I want you to close your eyes. Okay, you're going to feel the cotton ball. I'm going to say same, or tell me when you feel it. I'm going to want you to tell me if you feel the same on both sides. Okay? Now, does it feel the same? Okay, we're now going to move on to a little vibratory test, testing your vibratory sensation in your lower extremities. So I'm going to take this right here, and I want you to hold, this is what it's going to feel like. Got it? Mm-hmm. Now I'm going to place that on your big toe, and I want you to tell me when you feel it and when it stops. Okay?
Zach's placing the tuning fork on the IP joint of the patient's toe. Vibration is the first sense to be lost in peripheral neuropathy. It's also lost in posterior columnar disease, tertiary syphilis, and vitamin B12 deficiency.
Okay, Bridget, I'm now going to test just a few of your reflexes.
Zach's going to check the deep tendon reflexes in the quadriceps and Achilles tendon, as well as the plantar response, also known as the Babinski test. Abnormal reflexes may help localize a pathologic cerebral lesion. Hyperreactive reflexes, also known as hyperreflexia, may show CNS lesions of the descending corticospinal tract. They may have associated upper motor neuron findings. These findings could be weakness, spasticity, and a positive Babinski sign. Absent reflexes, or hyporeflexia, show lesions of spinal nerve roots, spinal nerves, and peripheral nerves. They may have associated lower motor neuron findings, weakness, atrophy, and fasciculations.
Okay, Bridget, to finish up your exam here, I'm just going to examine your peripheral vascular system. Okay? So bear with me for a second.
Zach's going to start the peripheral vascular exam by inspecting. He'll have the patient supine, draped, and exposed appropriately, and inspect the lower extremities bilaterally. He'll then palpate the pulses, checking bilateral legs and feet for temperature with the back of his hands, edema, and tenderness, and palpating specific pulses in the popliteal, dorsalis pedis, and posterior tibial pulses. If he's unable to palpate the popliteal pulse, then he can place the patient prone and flex the knee to 90 degrees, noting amplitude here, and making sure that the pulses are noted bilaterally.
Okay, Bridget, final part of your exam here, we're going to perform what's called a Berger test. Okay, this is going to be looking for any chronic arterial insufficiency, which could also be a cause of lower extremity pain that you're feeling. Okay, so this exam entails, I'm just going to have you, so straighten your legs out. Okay, and then what we're going to do, I'll tell you when, but you're going to lift both of your legs up at the same time to almost 90 degrees for about 2 minutes. And then after that 2 minutes is up, I'm going to have you sit up and swing your legs to the edge of the table. Okay, and we're going to look for how long it takes the color to come back in your legs. Okay, so we're going to start this test now. So bring both your legs up if you can for me. Hold them there for 2 minutes.
Assuming 2 minutes have passed or max pallor of the skin has been achieved, we'll move on to the next part of the test.
Okay, Bridget, you can sit up for me. And swing your legs and have them dangle over the edge of the table here. And I'm just going to examine the lower extremities.
And Zach will be noting the time it takes for pinkness to return to the skin of the lower extremities.